How will you know that your baby is crying for hunger? As I told you earlier, that baby's language of communication is cry, and baby starts crying for anything and everything, starting from peeing, pooping, hunger, sleep, upset tummy, too cold, too hot, etc. So how will you make out if your baby is crying out of hunger? Usually try to feed in the gap of a minimum of 2 to 3 hours in the first few days. Okay, initially as soon as the baby is born, for the first 1 or 2 months, try to feed at a gap of 2 to 3 hours. Okay, so your baby would be most of the time sleeping, so try feeding at the gap of 2 to 3 hours. Even little more grace time is totally fine if your baby is sound asleep. Okay, but do not leave it for like 5-6 hours more or more than that in the initial few months. Okay, next, there are few signs that you could make sure, if present, it's because of hunger in your baby. So that these are called hunger cues. First and foremost, when the baby is hungry, the baby will make some sound like lip smacking sound. This means the baby is ready to suck the milk or is asking for milk. This is one sign that you need to look for. Second is when you are able to place the tip of your finger straight on near the mouth or touch the lips, the baby will start sucking the thumb or fingers, because it is thinking that this is the nipple and it's ready for feeding, so it starts sucking the finger. Okay, so you try to place or touch and stimulate the lips, the baby will try to grab the finger. So that is sign number 2. Sign number 3, if you try to place the fingers at the corner of the mouth, okay, from the side, the baby will try to move towards that side and start sucking the finger. So these are 3 signs. These are called hunger cues, which makes you understand, or which gives you the clue that baby is crying out of hunger. Baby is now wanting breast milk. So always make sure that your baby has hunger cues before latching onto your breast every single time, because all the cry is not for hunger. Okay.